How can I distinguish between normal vaginal discharge and watery discharge in early pregnancy?
Hey there! Welcome to today's video, where we'll be discussing an important topic for all the expecting moms out there. One common concern during early pregnancy is distinguishing between normal vaginal discharge and watery discharge. In this video, we'll explore the key differences and provide you with some helpful tips. So, let's dive right in.
Understanding normal vaginal discharge.
During pregnancy, it's normal to experience an increase in vaginal discharge. This discharge, known as leukorrhea, is a thin, milky white fluid that helps maintain the health of your vaginal tissues and prevents infections. Leukorrhea is usually odorless and doesn't cause any itching or irritation. It's important to note that the consistency, color, and amount of vaginal discharge can vary from woman to woman and even throughout different stages of pregnancy. In general, normal vaginal discharge tends to be thicker and stickier, similar to the consistency of egg whites. It may also have a slightly yellowish or off-white color.
Identifying watery discharge in early pregnancy.
Watery discharge during early pregnancy can be a cause for concern, as it may indicate the rupture of the amniotic sac or the presence of an infection. Watery discharge is typically clear and more fluid than normal vaginal discharge. It may resemble water or have a slightly mucus-like texture. To help you distinguish between normal discharge and watery discharge, here are some key characteristics of watery discharge in early pregnancy. 1. Consistency. Unlike normal vaginal discharge, watery discharge is more liquid and less viscous. It may feel more like water and can be more difficult to control. 2. Amount. Watery discharge tends to be more abundant than normal discharge. If you find that you're soaking through your underwear or needing to change your panty liner frequently, it may be a sign of excessive watery discharge. 3. Odor. While normal discharge is usually odorless, watery discharge may have a slightly sweet or musky odor. If you notice a strong, foul odor, it could be a sign of an infection and should be evaluated by your healthcare provider. 4. Associated symptoms. Watery discharge that is accompanied by itching, burning, redness, or swelling in the vaginal area may indicate an infection and should be promptly addressed.
When to seek medical attention.
If you're unsure whether the discharge you're experiencing is normal or watery, it's always best to consult your healthcare provider. They can provide a thorough examination and offer guidance tailored to your specific situation. However, there are certain situations where seeking immediate medical attention is recommended. Sudden gush of fluid. If you experience a sudden, significant release of fluid that is continuous and doesn't stop, it could be a sign that your water has broken. This requires immediate medical attention. Foul odor or unusual color. If the discharge has a strong, foul odor or is accompanied by an unusual color, such as green, gray, or brown, it could indicate an infection or other complications. Itching, burning, or discomfort. If you're experiencing intense itching, burning sensations, or discomfort in the vaginal area along with the discharge, it's important to get checked by your healthcare provider. I hope this video has provided you with a better understanding of how to distinguish between normal vaginal discharge and watery discharge during early pregnancy. Remember that normal discharge is typically thicker, odorless, and doesn't cause any itching or irritation. On the other hand, watery discharge is more